Welcome to the outpatient total joint replacement class. Thank you for joining me today. My name is Amanda, and I am a registered nurse that works here at our surgical center at Olympia Orthopedic Associates. Today, we are going to discuss your upcoming joint replacement surgery and things you can do to aid in a successful surgery and recovery. Today, we are going to cover who your team consists of, the risks and expectations of surgery here at our surgery center, how you can prepare for your surgery, transitioning home from our surgery center, your mobility and exercise expectations after surgery, and when it is an appropriate time to call your surgeon after surgery. Our surgery center is located on the west side of Olympia. It is located on the back side of our first brick building pictured here. You will receive a phone call the day before surgery informing you of your official check-in time. Your designated support person or coach is going to be the primary person caring for you after surgery, and they will come back into the recovery unit to participate in your discharge instructions and physical therapy you will receive immediately after surgery. It is highly encouraged you have a group of people who are willing to help you prepare meals, check the mail, transportation, and help monitor you while you recover. It is required you have someone to care for you for a minimum of 3 days around the clock after surgery. Your outpatient joint replacement team consists of your coach, your orthopedic surgeon, an advanced registered nurse practitioner or physician's assistant, an anesthesiologist or certified registered nurse anesthetist, your physical therapist, a registered nurse or LPN, and your total joint coordinator. Understanding the risks and expectations. Joint replacement surgery is a major surgery, and although advances in technology, medical care, and screenings have made the procedure very safe and effective, any surgery has potential risks. Some of these risks include blood clots, infection, nerve or tissue injury, dressing and wound healing complications, limited mobility or range of motion, and persistent pain or hardware sensitivity. Blood clots. The most common post-operative complication or concern for joint replacement surgery is blood clots or deep vein thrombosis. Clots form when blood cells clump together in one or more of the deep veins in your body, which is usually your legs. Blood clots become dangerous if they are to break loose and travel through the bloodstream and lodge in your lungs, heart, or brain. Signs of blood clots or DVTs include excessive swelling in the thigh, calf, or ankle that does not decrease if you lie down with your feet elevated above the level of the heart. Remember, toes above the level of the heart lying on your back. Pain, redness, warmth, and or tenderness in the calf of either leg. Clots can happen in the operative and non-operative leg, so please be mindful to keep an eye on both. We have all patients take some sort of a blood thinner to help prevent clots. Your provider will discuss this with you. How to reduce your risk of blood clots. Please be sure to get up and make small walks around your house hourly during your waking hours. This will encourage blood flow and reduce the risk of clot formation. Perform the exercises we provide you with at least 2 times a day. Sequential compression devices, or SCDs, may be prescribed by your surgeon and can be purchased within our clinics. They are leg wraps that go around each calf and inflate to compress the deeper veins within the legs. This promotes blood circulation and helps reduce the risk of clot formation. Sequential compression devices will be applied to your legs during and following your surgery. They are worn on both of your legs because both legs are at risk of clot formation. Please wear them as much as possible until your follow-up appointment. If your provider prescribes you SCDs, please bring them with you to the surgical center on your day of surgery. Infections. Infections, although rare, do sometimes occur after surgery. It is important to monitor changes to the area around your incision and the actual incision. Some redness, heat, swelling, and bruising around the incision are perfectly normal. Call your surgeon if redness increases and the pain doesn't subside. Please be mindful bruising is to be expected. This is normal and can be quite extensive, especially for those having surgery on the knee. A tourniquet is placed on the upper portion of your thigh and inflated for roughly 1 hour to help prevent blood loss during knee replacement surgery. This can, and oftentimes does, lead to extensive bruising in that area. Swelling can be quite impressive as well. The use of ice and elevation will help reduce the swelling. Please report a fever greater than 101 degrees and any abnormal increases in wound drainage. A low-grade fever is fairly normal after surgery due to the body's response to the healing process. Please report if the clear drainage changes color and has an odor. Dressings and wound healing. A large antimicrobial dressing that encourages wound healing will be placed over your incision and removed at your first follow-up appointment, which is usually 10 to 14 days after surgery. Please keep this dressing dry and intact. Please do not remove the dressing unless instructed to do so by your care team. You can protect this dressing while showering by covering the dressing with a clear plastic wrap. Surgical incisions can sometimes heal slowly. Swelling can impede the healing process. You will be instructed how to care for your incision after surgery and ways to reduce risks associated with poor wound healing. The appearance of blisters with redness may occur due to excessive swelling or a sensitivity to your dressing. Please contact your care team if this happens. How to reduce your risks of infection. You will receive protective IV antibiotics in the operating room to help reduce the risk of infection. Keep your wound clean and dry. Do not submerge the wound in water and always wash your hands prior to any wound care that may be needed. Perform exercise and activities as directed by your surgeon and physical therapists. This includes breathing exercises. Stop use of tobacco and substances such as alcohol. Tobacco narrows blood vessels and prevents healthy cells from making their way to your wound to help promote healing. Maintain healthy blood sugars before and after surgery. Microbes thrive in areas that contain higher levels of glucose. Nerve or tissue injury. Damage to the surrounding structures in the knee or hip, including nerves, blood vessels, and ligaments, are possible but extremely rare. More commonly, small surface nerves are cut during surgery. Nerve tissues can take roughly 6 to 12 months to recover. Common symptoms may include a burning sensation, electrical shocks, or a painful sensation. Additional ways to reduce risks. Follow the precautions established by your surgeon. Avoid high impact or balance activities until medically cleared to do so. Do not overdo it. Awareness. Look for signs or symptoms of problems. Early prevention and management improves recovery significantly. Avoid shaving or hair removal products on the surgical area for a minimum of 7 days prior to surgery. No pedicures for a minimum of 7 days prior to surgery. All dental care appointments must be completed at least 2 weeks prior to surgery. No dental treatment should occur within the 3 months following surgery. If dental emergencies arise during any of this time, please reach out to your surgeon's office for guidance. Tips for preparing your home. Accident-proof your home. This includes keeping items within reach of where you will be recovering. Add firm pillows to lower chairs to avoid additional strain on your joint when standing up. Prepare a bedroom on the main floor of your home if possible. Avoid recovering on a floor that requires you to maneuver stairs regularly. Be sure to use and/or install hand railings on all areas that have steps. Avoid tripping hazards. This includes electrical cords, throw rugs, and small items on the floor. Remove them from your walkway ahead of time to avoid a fall. Be cautious and aware of small pets as well. Preparing your skin for surgery. Shower with an antimicrobial or an antibacterial soap the evening before surgery. You will need to pick this up on your own. Soaps such as Dial antibacterial bar soap or Hibiclens body wash can commonly be found at your local pharmacy or grocery store. Your surgeon may or may not prescribe skin prepping wipes. If so, please wipe down the surgical area after bathing with an antibacterial or an antimicrobial soap and drying off with a clean towel. No lotions, creams, or deodorant should be used on the operative side after skin preparation. Avoid shaving or hair removal products of the surgical area for a minimum of 7 days prior to surgery. No artificial nails or nail polish, including gel, on your toes or your fingernails. Please remove all removable jewelry or any metal from the body and leave that at home. Wear clean clothes and sleep in clean bedding after the skin preparation. Assistive devices. Assistive devices include SCDs or sequential compression devices, a front-wheeled walker, an ice machine, a cane, a shower chair, a reaching device, and a detachable shower head. Please bring your SCDs and front-wheeled walker to the surgery center on the day of surgery. Our SCDs and ice machine units can be purchased within our clinics and at your preoperative appointment. They are not sold at our surgery center. Countdown to surgery. 4 weeks before surgery. Verify you have an established coach and support system. Complete any lab work or assessments ordered by your surgeon. Watch the total joint replacement educational class video as many times as needed. Review your guidebook. Watch our rehabilitation physical therapy videos. Start to reduce alcohol intake. No alcohol 48 hours prior to surgery. 10 days before surgery. Stop taking supplements as instructed by your care team. Stop taking aspirin, blood thinners, and anti-inflammatory medications as instructed by your care team. Stop shaving or using hair removal products for a minimum of 7 days prior to surgery. Obtain your assistive devices. Set up your physical therapy appointments, and start your home preparations. The day before surgery. Pick up all post-operative medications. Please leave your post-operative medications at home. You will not need to bring them with you to the surgery center on the day of surgery. Change the linens on your bed. Shower and cleanse your skin as directed. Do not eat or drink anything after 10 p.m. No chewing tobacco past 10 p.m. either. The day of surgery. Wear clean, loose-fitting clothes. No fragrances, deodorants, or lotions. Take prescription medications as instructed with only a small sip of water. Bring your post-operative assistive devices. Only bring medications that were instructed by your nurse to bring. Do not bring valuables and remove all of your jewelry, leaving it at home. And you must bring your CPAP or BiPAP machine. Arriving at Olympia Surgery Center. Your coach must come inside to check in with you because they will be asked to sign an acknowledgement that they will stay within 10 to 15 minutes of our surgery center while you are here. Your coach is welcome to wait in the lobby, their car, or they may leave as long as they are not more than 10 to 15 minutes away. Your surgeon will call them once your surgery is complete, and that is a good time for them to head back to the surgery center if they did choose to leave the surgical center. Once you are checked in, a nurse will call you back and review your medical history. You will then be prepared for surgery. This includes changing into a gown, removing dentures, glasses or contacts, and hearing aids. Please bring a case for each of these items to protect them. You will be visited by your surgeon. You will also be visited by an anesthesiologist or a CRNA. And your family may wait in the lobby while you are in surgery if they prefer. The operating room. You will transfer to the OR bed. Compression pumps will be placed on your legs. Nerve blocks, spinals, and general anesthesia are administered in the operating room. The type of anesthesia received is determined by the anesthesiologist or CRNA and the patient together as a team. Total surgery times will vary. Once surgery is over, you will transition to the recovery room. Recovery care. Transfer from operating room to the recovery area will occur. You will wake up and recover from anesthesia there in our recovery unit. You will be cared for by our nursing staff in recovery, and together you will work on managing your pain. We will work on sitting you up in a chair, having you drink something, and possibly have a light snack. Your coach will accompany you in your discharge instructions and physical therapy in the recovery unit. Physical therapy will start an evaluation with you and begin getting you up and moving around. You will need to meet the discharge criteria prior to transitioning home. This includes demonstrating mobility in the joint. Your pain and nausea level must be controlled. You can independently and safely function. You must be able to urinate. And you must have a confirmed coach or family support at home for a minimum of 3 days around the clock. Discharge typically takes 1 to 2 hours on average. Transitioning home. Be sure to review your discharge and medication instructions. Activity. Get up and move around every hour that you are awake. Reference your discharge instructions. Wound care. Keep your dressing dry and intact. Manage your swelling. This includes ice and elevation. Reference your discharge instructions. Diet and rest. Increase water and protein consumption. Limit carbohydrates. Pain management. Stay ahead of your pain. Refills for medications. Please reach out to your surgeon's office directly for all medication refills. Refills may take up to 72 hours, so plan your medications accordingly. Swelling and pain management. Ambulate. Get up and move around for 5 to 10 minutes every waking hour. Elevate. Place a pillow roll under your lower leg or a towel roll under the ankle. The ankle should be above the level of the knee. Ice. 30 minutes on, 30 minutes off during waking hours. Do not place ice directly on your skin. Please use a barrier to avoid skin injuries. Medications. Please be organized and take medications as prescribed. This includes stool softeners to avoid constipation from opioid use. Maintain a pain medication schedule and always stay ahead of your pain. Nerve blocks will help with immediate post-operative pain. Your anesthesiologist or CRNA will discuss those with you. Mobility and exercises. Follow your discharge and physical therapy instructions. These home activities are vital in helping you return to your normal activities. Exercises are designed to increase strength, flexibility, and function. Outpatient physical therapy. Make your appointments as soon as possible. Please do not wait to do this. Physical therapy appointments need to be made prior to your surgical date. Outpatient physical therapy should start within 1 week of surgery. When to call your surgeon. A fever greater than 101 degrees, increasing redness or drainage from your incision. Remember, some redness and bruising is to be expected. Severe swelling in the hip, severe swelling and pain in the calf or the thigh, a blood-soaked dressing more than 2/3 saturated, a new onset of cold feet after surgery, if you fall, severe or intolerable pain that is not controlled by your prescribed medications, and please reference your discharge instructions for further information. Thank you for allowing us to assist you on this journey. Please visit our website for additional videos on ways you can help promote safe surgery and a successful recovery.